do want to take a moment to turn the page for our weekly Simple Health segment. We know eating disorders are on the rise among children. Children are developing them at younger ages, and that's of course creating a major concern among families and also pediatric doctors. And much of the time, early warning signs for eating disorders can be missed among patients. So joining us today to talk through some of this important topic is Dr. Allison Chase with AK Chase Consulting. Dr. Chase, thanks for being here today.
Thank you so much for having me.
So talk to us first about some of the statistics we're seeing. What are the trends as it relates to eating disorders that have pediatricians so concerned?
That it's showing up earlier. That we are seeing younger children that are engaging in restrictive behavior, that are changing their eating habits, that are overly concerned with their body image and their self-image. And all of that is showing up in ways that are what we call kind of dropping them off the growth curve, which is always concerning from a medical standpoint. Kids should be growing and developing, and if they're not, it's a big problem.
What do we know about what's contributing to that rise and the earlier diagnosis of this?
Yeah, such a great question. So there is no one cause of eating disorders. It is a complex diagnosis, kind of genetics and heritability, as well as our environment as well. One of the hypotheses here is that we have social media that has shown up, right? Making our environment even more complicated in that messages are popping up. These young kids have access to messages. In addition to, I mean, puberty seems to be starting a little bit earlier too, right? So bodies are changing a bit. You get the combination of those pressures, and it's somewhat of a recipe for this really unhealthy pattern.
Talk about some of the warning signs that a parent or a loved one might be on the lookout for when it comes to an eating disorder in a child.
Yes, well, we definitely want to look for changes in eating patterns and behaviors. If you notice they're restricting, not eating as much, or maybe sometimes you're finding wrappers in various places, maybe they're engaging in overeating. If you start hearing that they don't want to join you for the family meal or things are changing, so you want to pay attention to the food piece. You also want to look at like how they're acting, their emotions, their behaviors. All of these things can point you towards a real concern.
You mentioned concerns about their growth, their development, but what are some of the other impacts of an eating disorder like this on a child?
Well, it can mess with their relationships, their friendships, how they're doing in school, what they're engaging in. Just being able to sort of be out there and be a child when they are so consumed with what they're eating and what their body shape and weight is like, and also are sometimes lacking the energy from not having enough food, right? It's going to be messing with all the things that their childhood life brings, which is really, really a concern, and including an impact in the family. These families are being sort of overrun with this eating disorder that's showing up.
I can imagine for a family, it's hard to know where to begin to start talking about this.
Yes.
What would you recommend to a parent or loved one? How do you start to have that conversation about, hey, we need to take some steps to get you healthy?
Well, and I love that you brought that up, starting the conversation. There are a lot of families and parents that don't want to say anything. That is not the approach to take. You are not going to make it worse. You are not going to be doing that at all. Start with being curious about what you're noticing and what the behaviors are, because having that conversation as early as you can, that is one of the indicators that we know really helps to move through with treatment and recovery, catching it early. So asking the questions, wondering what's happening, and then being able to take a look at kind of what you can do about it.
Last, I know this does not discriminate age-wise. Even us as adults, we can struggle with a relationship with food. Any tips you have for adults in how to maybe model that healthy behavior with food?
Well, I love what you say about modeling that healthy behavior with food. Being able to not have the good foods and the bad foods, not being overly preoccupied with it, kind of caught up in all those unrealistic messages that are out there is really important. So being able to do that and to recognize that these issues they do happen at any age. You are absolutely right. And taking care of oneself is a priority.
Such great reminders, and we are lucky to have doctors like yourself following these trends, helping our kids and all of us in Central Texas. Dr. Chase, thank you so much for your insight.
Thank you.
We appreciate it.